Hey, it's me, Jen again, and today I'm going to show you an illustration of how thyroid RFA works using layman's terms after this. I've been wanting to make this video for a while now, but I just haven't had a chance. I've been so busy. This year, I've interviewed 5 patients, 20 doctors in 3 different countries, and made a total of 124 videos. But now I wanted to bring you one last video before signing off to take a much needed break for the holidays. So in this video, I'm going to show you an example of how thyroid RFA works in layman's terms. And I'm also going to emphasize 2 very important facts about thyroid RFA. Number 1, thyroid RFA is a thermal ablation. And number 2, thyroid RFA is only for thyroid nodules. Let's dive into those just a little bit deeper. Thyroid RFA, which stands for radiofrequency ablation, is a thermal ablation. This means that the procedure uses heat to target and destroy thyroid nodules. Commonly, when people hear the term radiofrequency, they incorrectly assume that it means radioactive, but this is incorrect. There is no radiation or use of radioactive drugs in RFA. Radioactive iodine therapy, or RAI, is another type of thyroid ablation, but there are several major differences between this treatment and thyroid RFA. RAI is a drug given to a patient that indiscriminately kills the thyroid gland. This is used to treat hyperthyroidism, an overactive thyroid gland, or hot thyroid nodules, nodules producing excess hormones. Because this treatment destroys the entire thyroid gland, it results in permanent hypothyroidism, making the patient need to take thyroid medication for the rest of their life. Another type of thyroid ablation is chemical ablation. This means that a chemical, usually ethanol, is injected into the thyroid nodule, or more often fluid-filled cysts, to directly target and shrink them. This is referred to as PEI, percutaneous ethanol injection, or EA, ethanol ablation. It's similar to RFA in that it's used to directly target a treatment area. When used in cysts, it causes the inside of the cyst to scar over and prevents it from refilling with fluid. There are some disadvantages to ethanol ablation, however. Primarily, the ethanol can leak out of the intended target area and cause some scarring and pain in the surrounding areas. But for thyroid cysts, it's a very effective treatment. The main advantage is that it is very low cost. For solid thyroid nodules, thyroid RFA has an advantage over both of these procedures: control. The tip of the thyroid RFA probe heats up only a very small area. This allows the practitioner to very selectively target just the areas that need to be treated. Over time, the nodule will shrink, which alleviates the symptoms the nodule was causing. The remaining thyroid tissue functions as if nothing happened, eliminating any need for thyroid medication after the procedure. A common question I'm asked is, can thyroid RFA be used to shrink my enlarged thyroid? The answer to this question is no. Thyroid RFA is used only to directly target a thyroid nodule. If you have an enlarged thyroid without nodules, then RFA is just not indicated. Now, on to the demonstration, which will illustrate how thyroid RFA works to target thyroid nodules. So earlier this year, I had this great idea to demonstrate how thyroid RFA works using a wood burning tool. I've never done wood burning, but I am very much into all things artsy, and I figured it would be fun to learn how to do that. I watched a few videos on the topic, and there are many wonderful tutorials about this on YouTube, but I never really had a chance to practice before attempting to make this video, so be nice. So here's my second ever attempt at wood burning. I've already drawn out an outline of the thyroid and the nodule, and here's the part that shows what doctors call the moving shot technique. The probe is inserted into the nodule all the way to the back, and then is gradually moved across. It's moved from back to front, working across the nodule until each layer is treated. Now, because this is a flat 2D example, you won't get a full sense of how the 3D nodule would be treated. But in that case, after the bottom level is treated, the probe would just be moved upward to treat the next level. Repeat until all areas have been treated. Moving forward and then moving the probe back to the back and I'm just gradually working my way towards the front. Burn, baby, burn. Done. Ta-da! I actually preferred the way this side of the board turned out, but unfortunately, all that the footage showed when I filmed this side was the back of my hand and not the tip of the probe burning the nodule. When I switched out the tip of my wood burner, the tip got cross-threaded, and after I finally was able to remove it from the tool and replace it with a different one, the new tip would not fully screw into the tool, so I may have destroyed my wood burning tool. But at least I was able to show you some semblance of what I was going for. Admittedly, this video is not all that great. And after I made it, I just felt like it didn't do an adequate job of demonstrating how the procedure works. So because of that, I made a short video using graphics to demonstrate thyroid RFA. Okay, so in this video, I put some graphics together in Canva to try to show you a little better of a demonstration of thyroid RFA. A really rough explanation of thyroid RFA for lay people. So first, the doctor will inject lidocaine into the thyroid. This is so you don't feel any pain from the heat during the ablation. The doctor will use ultrasound to find where to insert the RFA probe. And the probe is inserted here into the middle of the thyroid, which is called the isthmus. If your thyroid were a butterfly, the isthmus would be the butterfly's body and the lobes would be the wings. Once the probe is inserted all the way to the rear of the nodule, the ablation will be started. And working in very small sections, which are just millimeters in size, the nodule is very gradually treated. So they're just moving, treating, and moving to the next spot, and treating, and continually moving until all of the areas are treated. Once the whole nodule has been treated, the procedure is complete. Ta-da! Then immediately after RFA, the doctor will perform another ultrasound to take a look at how everything looks. Pause game. The nodule will look very different after RFA. Think about it. When you burn wood, it gets dark and its shape changes. The same is true when nodules are ablated. On ultrasound, they will become very dark, and as they shrink, they will become slightly irregular in shape. This is completely normal, but I'm going to tell you something very important about this. Any future doctor who doesn't know you've had RFA is going to assume very bad things about this thyroid nodule. The visual characteristics of an ablated nodule can look very suspicious and similar to a cancerous nodule that has not been ablated. To avoid any unnecessary concern, make your future physicians aware of the fact that your thyroid nodule has been ablated. Even better, put them in contact with your RFA provider so together they can talk about your procedure and clarify everything. Okay, now back to the demo. Over time, your thyroid nodule will shrink. How does this happen? Well, your body has to dispose of the dead, burnt tissue. Shrinky, shrinky. Little by little, the white blood cells will dispose of the dead tissue, which causes the nodule to shrink. The nodule may never completely disappear, but it will most likely shrink between 50 and 90%, which will alleviate any symptoms you were having when the nodule was at its full size. And your thyroid will still function. That's a win. In conclusion, thyroid RFA is a really amazing treatment option for thyroid nodules. It is one of 2 thermal ablation procedures available in the United States. To learn about the other one called laser ablation, watch this video. Stay tuned in 2022 for an updated video on PEI. Did this visual explanation help you better understand thyroid RFA? If so, please let me know in the comments. If you found this video helpful, please consider subscribing. This channel will always bring you educational content exclusively on the topic of thyroid nodules from the perspective of a patient. To my knowledge, nobody else on YouTube is doing that. So subscribe and stay in the know. You can also read my blog at itsmejenagain.com. Thanks so much for watching. Have a Merry Christmas, a Happy New Year, and I will see you in 2022.